his end. But we'll do the best we can. So to get started, I'm Mudhiambo David. I'm the co-founder of Agriculture, Health and Social Innovation, which is a social enterprise that has been in practice for the last 2 years from 2017. So we are clocking our 3rd year by the end of this year in November. So that is agriculture, and our focus is on promoting health education and sensitizing the public to take an action in terms of improving access to healthcare services and leading fulfilling lives. So that is our mission as an organization. So when we looked at it in this topical issue that has been a concern in the public of Kenya, every other person has a challenge. When it comes to corruption, currently we are talking of over 43 billion Kenya shillings that can't be accounted for from the Kenya Medical Supplies Agency, that's KEMSA. So much has been misappropriated in the different government agencies, in our local spaces. But the question is, we see it when it's highlighted by the government official, by the media, at a higher level when we're talking about billions and billions of money. But is it that corruption is only at that point in place? Is it that corruption is domiciled within the Ministry of Health? Is it in these different agencies? Or it's something that we live it every other day and we live with it with us and we accept it when it's happening within our spaces. But when it gets to the government positions, when it gets to catch the attention of the media, that's when we make it a sensational matter. So for me, I'm not going to say that corruption in the government agencies, in the different bodies that we are attending to, it's not an issue. It is an issue, and it's something that needs to be addressed. But the only thing that we also have to acknowledge is that corruption is not starting at the ministry level. Corruption is not starting at the agency level. Corruption has been with us, it is with us, and at the end of the day, for it to come to an end, it will be upon me and you to make a conscious decision and to decide that we are going to make that change. And it starts with me and you making that decision. So the reason as to why I mentioned the aspect in terms of bringing a vaccine to corruption. Hello? So when I talked about talking about a vaccine to corruption in the healthcare space, as we all might acknowledge or might have an idea, when we had different diseases, especially the viral diseases, the main mechanism that was being put in place to address them was adopting a vaccine. With vaccination, we hope we are preventing anything from the start of it. That is the way that we can uproot it from the root cause. Last month we had the declaration by the World Health Organization that Africa is polio-free. But Africa is polio-free because we moved as nations, we moved as leaders and every other person within the continent to ensure that vaccinations were being given to the kids at the point of birth and subsequently for 3 consecutive times. And then now we even have the polio injection, the pentavalent polio injection. So these are measures that have been put in place to ensure from start, it's something that we're preventing before it even becomes a problem. And how do we make that happen? So that is one thing that we need to factor in terms of the corruption, because this is a virus that is in our system. It's kind of growing within our DNA. I remember earlier last year, there's an article that I wrote. We're talking about corruption, pointing fingers and every other thing to the leaders that we have and the misleaders that we have seen in our systems. But the question we never get to ask ourselves as individuals in this society is, are we byproducts of corruption? Are we perpetrators of corruption? Or we are beneficiaries enjoying the privileges when it comes to us, but ready and very willing to point fingers when it's not on our end? That's a very important question that we need to ask ourselves. And in that article, the main issue that I was bringing in is, at that point, it was about our education system, people talking about corruption in the education system, schools charging exorbitant fees and all. But if someone who has been, what if you are the person who has been a beneficiary all through of this corrupt system, where you have a parent who has been a corrupt individual who has been getting corruption money to finance your education, buying your way into prestigious institutions, prestigious training institutions. Then you go through the system knowing that you'll always buy your way out because there's money in it. That is corrupt, because at the end of the day, it denies an individual a chance to get the right quality of services, the right quality of education or such kind of a thing in that particular context of education. But when someone steals at another point, you'll mention it as an egregious act that is against you. It's a commission of an offense against your right as a human being, as an individual, as a nation, and as a continent altogether. So at the end of the day, we have to acknowledge that corruption exists in different forms. And for us to eliminate it, we have to make a conscious decision from the start and know that either way, We are accomplices, we are beneficiaries, we are perpetrators, and each of us has a role. When someone steals at a particular point, you're not, if you don't mention it, you're an accomplice. You're helping that person, you are abetting that corruption to continue. And the only thing that you'll make noise is when it gets the media attention, every other person is focusing on it. But what happens at that point? That is a point where we'll need a cure because it's already out of control. What if we can curb it at an early stage? What if we can uproot it when it's still just forming? What if we can vaccinate it and make it not be a component of our ecosystem? Because that would be the ideal case. Because I know every other person who is joining this conversation today, we want to end corruption, and that is our mission as a group of people. So for us to end corruption, we need to start from there. And in the healthcare system, as we are talking about it, in the current space, people are talking about corruption at KEMSA because of the procurement practices. Kenya and most of, actually globally, we are people who believe in deals, and these deals are dirty as they are. I remember last month, I also watched another clip from Uganda that was recorded last year in 2019. It was done by the CNN, and they were looking at the corruption and the corruption syndicate in the Ugandan system where vaccines, medical supplies, especially anti-malarials, were being stolen by the healthcare workers and being distributed through parallel channels, drugs that are not supposed to be sold, but they were being sold in the black market. That was an issue. So it's something that is with us. And most of it, we talk about the procurement bit, selling products and services. But where does corruption start? What is the, we look at it from the component of a healthcare system. The healthcare system starts from a patient perspective, through the patient to the healthcare provider who is interacting with that patient, to the procurement of the supplies that will ensure that the healthcare worker can give services to the patient, quality services, not only services, but quality healthcare services that can enable them achieve positive treatment outcomes from that kind of service. And in the same time, we look at it in terms of the governance, the management system that are in place. So we could cover the whole 6 pillars of healthcare services, from human resources, quality management, and all that. And then from there, we now see that health has a great component of it. And with that great component of health services, we have to factor how we can improve it and we can curb corruption from that point. It's an advocacy agenda from start, and it's an actual advocacy where we look at not only speaking against it, but acting to conform with the values that you're saying. And the examples that I'm going to give are some of the actual cases that we all of us have heard about in our different areas of operation. Started from this one. When you are sick, you go to a hospital, a private health, let's say a public health facility, a primary healthcare center. You need to get your medicines. Most of these has been procured through KEMSA now because the government directive that came last year was that every procurement of medicines and healthcare products be through KEMSA to government, through the county, and even the national hospitals. That is ideal. But in this case, you go to a hospital, you get these medicines today, then you start using them. The next day when you come in, you probably feel you're not better, and you're being told that you need to take that medicine for, let's say, 3-4 days onwards before you can see positive outcomes, like you can start responding to it. But instead, you start making a claim that the drug is not working as much, you're suggesting an alternative. You'll pick another drug, or probably the same drug, another dose of it, which is not good for you at that point. You don't really need it if you already have the other alternative, but you just take it because you want to have your own stock at home. By you doing that, another person who might be sick, and because of our irregular supply in the pharmaceutical system, then another patient who will need that drug when they come to that hospital will not get that drug. Are you not corrupt? Especially in a system where now all these drugs through the county health facilities, they're being given free of charge. You are denying someone access to care, and in a point when you're not supposed to, because you already have an alternative, you have another drug that had been given. And this is something that I noticed when I was practicing as at a primary healthcare center. Patients will come and keep asking for the same drug, yet they really had the drug that was given to them earlier. So it's upon me as a healthcare provider to let them know, we are not going to do this, because when you're taking this extra drug, you are denying another person an opportunity to get the same drug when they really need it. And that is compromising their care. That is corruption. But when you talk about corruption, that never captures the attention. So as patients, we also corrupt in a bit. Very important. Move from the patient perspective. We come to the healthcare provider. You come to a health facility where a doctor or a clinician or a physician somewhere who is attending to you at the point of care gives you the information, they advise you and recommend for you a drug that can be used. The drug might be or might not be in the health facility. But when you're leaving the health facility, they are referring you to a specific pharmacy or a chemist, a drug outlet outside there because of their financial interests. Probably you'll buy an expensive drug, or you'll buy just a good drug for you, but it's aligned to their financial interest that will make you go to that facility. That is a corrupt case in that they are influencing sales of that person, and it means even when chances are at some point of time they might be influenced to direct you to a premise and to get a drug that might not be ideal for you as a patient. That's a case of corruption. But what do we do about such? We need to bring it to light. And when, as a healthcare a patient who is interacting with the healthcare system, you get such queries asked to you or such directives given, you need to ask, what is the rationale? Why do you really suggest that I go to this pharmacy? Because we have almost 5 pharmacies next to our blocks in where we stay. So why not to another pharmacy, but specific one that you're suggesting to me? We need to probe and make people feel uncomfortable in lying to us and uncomfortable in taking advantage of our situation so that we make redress for such issues. That's another thing. Move it to the health facility. How many charges are there that are not really necessary? You come to a hospital, let's say, for example, now at this point in time, we know in Nairobi and some of the urban settlements in the country, we have high cases of H. pylori. With high cases of H. pylori, it doesn't mean that any condition will have H. pylori. There are certain cases that you might rule it out or you might not rule it out. So at every point when you interact with the healthcare system, you have a GIT problem. The first thing is H. pylori, 1,000 or 1,500 or even 2,000, depending on the institution where you go. Is that test really justified? Is there any medical justification or the rationale behind that kind of a test? And it's not only that, there are so many other tests that might be performed on you as a patient when you go to a health facility that might not be justified, but they are going to be performed because those are avenues for getting some other extra revenue streams. We need to be rational and we need to question in terms of the health management systems. What guides the requisition for a particular procedure in a hospital facility? Is there any evidence behind it? What are the differential diagnoses that have been made to know that this patient might be suffering from this? Because once we do that, we'll be averting the probable issues that we might be facing with our healthcare system. If we don't do that, we are losing the battle because we'll have unnecessary procedures being conducted on patients who are spending money that is not necessary, and the health system or the hospital that in question is taking up that money. And that money should not really be taken up for that purpose. And another person might not be able to cater for their needs in a society that really needs that extra coin in their pockets to cater for their needs. That is something that we need to cater for. The same case of the hospital setup. We have healthcare workers where you find a medical representative comes in, they give you certain drug packages and medicine packages for you to test on certain patients. They're supposed to be given out for free because you are going to use it in giving recommendation whether they are effective or not effective. But in certain situations, these are still sold to patients. And this is where we talk about payments under the counter. It's not over the counter in terms of, we try to hide it as much as possible. I'm selling to you a drug that I shouldn't be selling to you because it's a free sample to assess whether it's effective in treating you or not. But we still sell it. Is it justified? Not really. But the question is, what legal provisions do we have around some free samples, free gifts, and such kind of donations when it comes to healthcare products and services? It will enable us to continue with corruption if we don't question it. But if it's questioned and there are clear guidelines on how that should happen, then the patient who is going to be used in terms of given a sample to verify the efficacy will give information, and that guides the proper treatment of patients in the next phase of care. That is ideal. But does it happen? That is a question for me and you to answer. Then look at it in the other aspect now from the health facility. What drugs are you being given? I'm a pharmacist, and as a pharmacist, I know I have to make clear judgment on the drugs that I'm going to give my patient. And the drugs that I'm giving my patient, they should be able to give them the quality of care they deserve and they expect from me as professional. So in that case, what I look at is, how effective is it? Is there any cheaper alternative that I can give this patient? And other than giving them multiple drugs, are there combinations? Or is there any drug that I can eliminate that doesn't have that much value to the patient, so that we reduce the number of drugs that we give? But you come to me, I give you 10 drugs, And of all the 10 drugs, I tell you, this is treating fever, this is treating cold, like every symptom is being treated differently. Then what is the disease? There's no disease that is called headache. There's no disease that is called fever. There's no disease that is called running nose. There is supposed to be a differential diagnosis that's pointing us to a particular disease condition that's caused by either bacteria, virus, protozoa, or even just a minor infection and an immune reaction of your body. So in that case, there's a particular drug that is ideal for that patient. But if we don't do that, we are affecting the care that you as a patient gets to receive. And when we affect that care that you receive as a patient, that is a corrupt act, because we are compromising on your care and even subverting resources that would have been used in alternative purposes for the betterment of our society. That is a corrupt bid. But then we don't have a clear definition for what we term corruption or not. But there's some bias in it, there's some injustice in it. And any form of injustice is an act of corruption, unfairness, and it's not ideal in our healthcare system. Now we've talked about the patient, the physician, the health facility that we're talking about, and even the procurement practices. Move it there to the government and the different management policies that we have in place. We have agencies that are in place to procure drugs. The Kenya Medical Supplies Authority, currently at the limelight, being questioned every other time. What have they done right and what have they done wrong? That will be you to judge based on what information we've received from our end and from your end as well. But it's something that needs to be attended to. And for it to be attended to, we have to look at it in terms of what are provisions. You're being told that there has to be technical, financial, and a track record of good practices in terms of a company's performance before they can be awarded a tender. But what's happening? Tenders are being awarded without due diligence being performed. Because as a society, we've been part of the deal economy. What deal can I get? How much can I make out of this? So that is what, as a society, we are looking at. So these are measures that have to be put in place, and they have to be followed up to the end on how it should be done. Initially, when Corona started, we had the issue of a laboratory, a director actually at KEMSA, Kenya Medical Research Institute, being fired because of issues of failure to report. That was what came from the media. And there were issues, anomalies around the whole situation. Well, anomalies might happen, which is part of the human process. We are accustomed to having anomalies in our systems, but we have to take responsibility for them. There is an anomaly. What is the way forward in solving that anomaly? And other than that, what are the rationales behind it? In the same discussions and the whole controversial subject that we had, people were talking about people managing or heading, being part of the task force, who are not involved directly in research. They are lecturers, they are people in a training institution who are majorly inclined to the research in terms of the theoretical bit of it. They are not doing the research at the labs, they are not part of the clinical trials, but they are heading the ministerial meeting. How do they really actually know what's happening on ground? If they don't know that fact, then it means we'll be working with theoretical data that is reported or adopted from documents from WHO, from any other resource. But does it really meet the needs of our Kenyan people? And why would we spend extra bucks and extra resources to finance such kind of clandestine operations within our health system, yet they are not really serving the public? That is an act of corruption. And that is where we need to hold people accountable. Someone who is in this position, let them be actually involved in the care of patients and actually involved in, let's say, even if it's research, they have to be part of the system down there, because that is where the action happens. And that is where the action should guide the intervention that we are putting in place. And if we don't do it, that will be a failed system. That is at the government agencies and all. Now move it from government agencies and the corporations and the different parastatals, the different companies that we have. You have Megascope, Crown Healthcare. These are government organizations these are private entities that have been awarded tenders in the KEMSA issue. What were their capacities? And what is the inclination to offer these services? A product that is being given at a lower price, the market rate is half the price that you're quoting, and then the government agency is offering such a tender, then is it really justified? And what good due diligence are they performing? And then there are questions about government officials, the leaders in the very society, being involved in these kind of procurement processes. Then what are the criteria that are really stipulated in terms of involvement in business dealings as a government employee, actually as a civil servant? To what extent can you go in doing your personal businesses? If you want to relinquish power in the personal business and focus in being a civil servant, there should be criteria for that. Otherwise, you should choose which end to fall onto. And this is not something that has been upheld in our country. And where they are not actually spelled out, people are taking advantage of that. And where they're spelled out, people are using people as proxies. I'll take on someone, let's say, for example, we have Hezron as one of the people I work with. I'll use Hezron as a proxy for me to be the face. But at the end of the day, it's me doing business. It's me pushing my agenda. And I'm stealing from the very public, because there's this thing that we try as much as possible to decline or to neglect, to feel like it's not happening, but it's really happening. If I am a public figure, a public influential person in the country, and in any business dealing, if I approach someone who already knows about me in the public domain, chances are they are willing to give me a business. It's not that I'm corrupting them, but that will influence their judgment. It's a matter of perception. So if they perceive me to be someone they can't trust in the end of business, or not even trusting, but someone they feel comfortable doing business, whether dirty or clean, then I'm already doing something that might not serve their interests or the interests of the general public who we need to serve. That is an act of corruption at that point in time. So the question is, to what end are we going, and to how far are we willing to bend law? So those are some of the issues that we talk about when it comes to corruption. Other corporations, we can talk about the pharmaceutical industry, the research around medical products and services, the vaccines that are now being developed. These are done by companies which are private entities, and at the end of the day, they are going to sell them. Beyond that, they influence physicians, the prescribers, to give them. Earlier on, we had issues about falsified data in justifying the use of hydroxychloroquine, which was not substantial, which was not true. So it's compromising care. That is the actual corruption, because it's because of my personal affiliations to that organization, my financial ties in terms of financing their research work, that will enable them or will make them continue to fund my operation. That is not true. So these are some of the things that we have to factor as well. Pharma industry, what influence? Today I was reading an article where there's a blogger that was writing about the influence that the US government and the different biopharmaceutical companies has. Government has given a number of financing support to develop a vaccine for COVID-19 to a number of companies. There's one called Inovia, Moderna, and so many others. And these companies have never developed any vaccine that has been approved for use. So what is the evidence of use? What is the track record in terms of the technical capacity? If there isn't, then there's no justification as to why we should have such being flaunted on us. And it's the same case we're having with KEMSA, where there's no background check, but at the end of the day, because you have close ties with someone, it will succeed at the end of the day, because you know the people who will give you the state protection, give you the credibility that you need. If you guys have an idea about the salient model of stakeholder, you know people who can make the public perception be in your favor. And that does not only help you as a person, but it kills the public, because it's us who need the drugs. And if a government approves a product that is not safe for its people, then whoever uses that product, whoever is going to consume it, is going to suffer the consequences. And that consequence, it might be me, it might be someone close to me, it might be you, or even someone close to you as well. So are you willing to go down that road, compromising on the care they receive because of an immediate or a kind of a reward that comes immediately at that point? Immediate gratification, as I would say. So those are very stretchy issues that need to be questioned and they need to be verified. And I'm glad that I'm working with the Kenya Association of Pharmaceutical Industries, that to an extent we try to put in ethical practices and standards to ensure our member companies, in terms of their interaction with healthcare workers, they don't influence them negatively to be able to prescribe their products only. They look at the patient as the main player in that field. That is the CAPI code of practice, which is ideal, but is it adopted by everyone? And that is something that as members of the public, we can also contribute to and ensure that this information gets out to the different pharma companies, that we want you to show your credibility by adopting a code of practice. And that code of practice justifies you not having a negative influence on how others are playing their part in the healthcare system. When that is done, it's a win for me as a pharmacist, it's a win for the public, because they have guarantee that the product they're dealing with will meet the standards, and whatever the physician prescribes is ideal for them at that particular point in time. So all these are very pertinent issues when you talked about corruption. It's me and you, and it has to be upon us to make a change. And when we talked about the vaccine and healthcare system, we need to uproot this vice as early as possible. Let's not let it grow. And not letting it grow starts from accepting that it is a problem that we face. In the current state, I was having a chat with a friend some point last week, and people are asking, how did these people get their way into KEMSA? Not in a way that they are concerned, but in a way that this person wishes it was them in that position. So it means it's an rot that is in the very society where we exist. It's like somebody stealing. It feels bad because they're stealing, but I wish it was me so that I would enjoy the benefits, the outcomes of that vice. Is it really the ideals that we want as a society? If it isn't, then we need to act. And we need to change it from the underground by talking about what really means to be justifiable and to be true to our cause, to be fighting corruption. Because if we are not fighting corruption by really uprooting the vice and talking about it to people that as a society, we should be able to shun corruption. If I want to bribe you, let's say, for example, I want to bribe Hezron, you would be openly willing to tell me, by the way, David, this is not something that I'm going into. And if that is your modus operandi, then you'd rather continue on your own. But for me, I'm off of that deal. If that happens, it means the majority of us will not be inclined to taking such deals. And even the people who are looking at leveraging of such opportunities will distance themselves. They'll feel scared. They'll feel threatened. And then when that doesn't happen, we have a generation that's coming up to take the leadership who are noble, who are credible, and people of integrity who can uphold the ethical standards that we want of them to be able to be holding public offices. But if that doesn't happen, we'll be talking about corruption when the media brings it to our attention, when there are coverages that are done of 43 billion being lost, not being accounted for. But is it really solving our problem? It's not. And it won't solve our problem unless we want to change it. The same note, we're having issues where the counties are complaining, oh, finances have not been trickling down to the counties. What has happened to the COVID money that has been channeled to the counties? They're still stealing. So it's a matter of people are complaining because they are not at the table where the corruption is happening. So we are fighting to be at the table where we can steal as much as we can loot as much as we can, but that is not the ideal of what we should be doing when we're talking about corruption. Because in terms of corruption, we want to end it in all its forms, from the patient seeking more medication than they really deserve, to the end user taking, to the physician taking care of you the ideal way they should, to the hospital taking the bare minimum. You look at the COVID tests, how many people are being tested, to the leadership that is ensuring that these people get the quality services. Now we are being told about decline in the COVID-19 cases. Is there really a decline in the percentages that we're having? If there isn't a decline, then we need to ask ourselves, which people are being tested? Most of the people currently being tested for COVID-19 are people who are going to seek the services, let's say from the people who are going to get privately tested because they can pay for it. The people who are having issues, who can tell us the actual scope of who are positive and who are not positive, are the general public who might not be able even to afford that test. But are they really being tested? No. They're not being tested because as a country, we are willing to take the easier way out and show that we are making progress instead of really standing for what's really true. And if we don't do that, we are losing the battle. And we'll keep losing until we take it upon ourselves to know that whatever is wrong to me, it will be wrong to another person. And when it's only a matter of changing the tables and me having to be at the higher end, it's still the same problem, and it's upon me to make that change. So that is a very important bit that we all have to acknowledge. It starts from us, and that is why we're talking about vaccination. We need to vaccinate every other one of us to shun away corruption, to shun away corrupt deeds, and to be of integrity, because that is what is critical for us at this point in time. If we don't embrace it as part of our genetic makeup, our DNA, the scourge of corruption and all these mess that we're seeing, it will continue thriving. It will thrive in me, it will thrive in you. And then the next person who is going to lose, one of your people will die of COVID-19 when you would have stopped it. And when that happens, you'll feel the pain. I remember on Friday I was watching a video interview, the Citizen TV, that was Citizen TV, yes, an interview by Nimrod Tabu and the group. And they're talking about the challenges. He felt it because he lost a brother. And he's talking about it from actual experiences. What are we really doing as Kenyans? What am I doing, someone who is not affected yet closely by someone within my circle? And what can we do moving forward? It's very important. It's a pertinent issue that we have to attend to. And if we don't, we'll have lost the battle. So let's make the right decisions moving forward. And for the people, current ills that are already in the society, we need advocacy to ensure that this mess is being sorted and this mess gets eradicated by the people being culpable to corruption, the people who have been implicated. When they resign, and the money has to be taken back to the government, to the public who really needs these resources. Because we can't say there's no evidence, yet there's evidence. We all know there's evidence. You can't tell me that we can't track the amount. We can't have any evidence against anyone, and the money moved from the different funders who donated it to the treasury. Treasury moved it to MOH to the different people who bought the product. Let's follow the trail of that money. There's no evidence if only there wasn't any transfer of money. The money has been transferred and the accounts are available. So it's a matter of financial institution partnering in the different agencies that are investigating corruption to find the trail of where the money went. And with that, we'll have found the people who are culpable and we hold them accountable, prosecutions happen. And on our end, we build a culture of social responsibility and a culture based on integrity and positive values in our society. If we don't do that, we'll have lost the battle. And I hope we don't lose the battle as soon as now. Because when we do, then Africa generally as Kenya as a country will not be able to meet our targets as a country. We'll have lost the battle. So let's not lose it. So thank you. That marks the end of my session. So I'll read the questions and the reviews and respond to them as soon as I can. And I'm having a blackout at my place, so it might take shorter. Alex Maina, I'll reach out to you.
Mine is to really thank you for this very, very important discussion.
Yes.
Because it directly relates to what we are doing. My name is Alex Maina from HENET.
Yes.
HENET is an umbrella organization that works with a civil society organization dealing in health.
Yes.
And we are presently doing a project that is exactly doing that. We are doing a social accountability, looking at the issues of accountability in the health sector, looking at corruption. So for me, this discussion comes at a very, very important time, and I would really love to continue with it. Most of the issues that you've raised are really, really pertinent. These are things that we all need to ask ourselves as Kenyans. And I like this thing that you said, that that we are all in it. It's me and you. At times we just point fingers, but the question is, do we really raise our voices to oppose what is happening? If we don't, then you are abetting corruption. So when people get turned back from hospitals to go buy medicines at pharmacies or other places, and they just accept it without raising their voice or their concerns, they're actually also part of it. So for me, this is very, very, very important, and we need a lot of awareness created to the Kenyans. We definitely need to have a vaccine, like you're saying, for this big problem. Thank you very much.
Thank you so much, Alex. I've received your email. I'll reach out to you and we'll keep the conversation going, find ways of collaboration, and make each and every one of us be accountable for ourselves and for the people who really need our support to eradicate this problem. Thank you. Anybody who has a question, a concern, a comment before we close the session? Well, if there's none, thank you everyone who came on board. We start from Manyango Michael, Alex Maina, Elizabeth Kagede, Hezron Munyakina, Valentine Abwaju, Wakudu Flora, Kodero Edmond, and Penina Karumba. And for all the other people who are following on our Facebook Live page, thank you so much. It's been a pleasure learning with you. We share this kind of information. Every Sunday from 4 to 5, we have a session on a different topic or area. And the main agenda behind this is we need to educate each other. We need to enlighten one another to know that we have a role to change our healthcare systems. Once you have the right knowledge, the right mechanisms on how to engage and take an active role, then we are going to make our healthcare systems better. Thank you so much, and see you again next week. Asanteni na mkuwe na jioni njema.
Asante sana nawe pia.